The following video will show you how to correctly adjust the Medi Soft OA Lite brace to the knee. To determine the correct size of the orthosis, please measure the circumference of the affected leg 15 centimeters above the center of the knee on the medial side. You can then select the appropriate product according to the size table. The brace comes with a set of wedges, a screwdriver, and exchangeable pads. The wedges in the wedge set are all marked with the respective function and the corresponding degree setting. Caution: the wedges should only be replaced by orthopedic technicians or trained medical specialists. To replace the wedges, release the joint from the nit. The screw can now be loosened and the wedge can be exchanged. For optimum wearing comfort, there is a choice of different condylar pads, air or foam pads. To change the condylar pad, detach the installed pad from the Velcro closure of the brace and replace it with the preferred pad. Adjust the strap system so that the patient feels comfortable pain relief. To do this, tighten the straps so that the pressure is comfortable for the patient. If necessary, shorten the straps. The strap ends can be removed for this purpose. Let the patient wear the brace for a few minutes. This will ensure a comfortable tension of the straps. If necessary, readjust the straps again. Inform the patient of the default settings as an orientation value.